Clinical psychologist Andrew Schwehm joins me now for more on how the coronavirus is affecting frontline workers. We just saw that heartbreaking story. I can't imagine what healthcare workers are going through, treating patients day after day, then sometimes losing those patients. How serious and prevalent are mental health issues currently in the healthcare industry now? And are we likely to see these problems linger long after this pandemic is over?
Hey, Francis, thank you so much for having me on. Yes to all those questions. There's been, as the story mentioned earlier, there was already an issue with fatigue and burnout amongst healthcare professionals even before the pandemic. That's always been an issue. Healthcare systems are always kind of strapped and the providers are overworked. And now obviously with the pandemic, things are getting worse and worse and worse as ICU beds are getting more and more taken over by these patients. It just creates an incredible toll on these healthcare providers who are being put into positions that they've never been put in before. A lot of providers are being called from units that they're not used to working on. You know, you're seeing dermatologists being called to ICU beds. They're trying to get all hands on deck, whoever they can get into these units. And so you're going to see a lot of providers who are not used to being put in these positions, and they're going to start to experience a lot of burnout around this, and some will experience, you know, a range of compassion fatigue from just having to do like that. Like in the last story, they mentioned, you know, having to sit at the side of a bed of a person who's dying. That's a whole new ballgame for a lot of these providers.
Yeah, certainly. And you have personally treated healthcare workers. What kinds of issues are you seeing most often, and what do you advise them to do to try to deal with them?
So what I would say that I'm seeing the most often is just not knowing what to say. I think at this point they're all just so emotionally drained. It's hard for them to even, in our sessions, to even speak to what they're experiencing. A lot of times they will use the session to not even have to talk about those things because it's just so tiring for them to have to talk about it at this point. And I feel so badly for them. There's times where I'm kind of at a loss for words for what to tell them or how to help them. Because of what's going on. We're all experiencing it, you know, at the hospital that I work at. We're all going through it. We do have some programs at our hospital, and I know a lot of programs around the nation, a lot of hospitals around the nation have programs like ours is called Battle Buddies. So we have people who we kind of get paired up with to be able to talk to. There's also Helping Healers Heal, which is trained mental health professionals who work with anybody in the hospital to kind of just as a place for therapy to be able to talk. The thing that I can say that helps the most is that oftentimes part of the reason why they created this Battle Buddies program was because people sometimes don't know what to say or who to talk to or how to talk to somebody. And they often say, you know, you need to open up, you need to open up. Well, sometimes people don't know how to open up. So it's important to have somebody that they can feel comfortable going to, somebody who they can feel like they can trust to talk with, and to have somebody who's sharing a lived experience with them.
And what about the toll on psychologists like yourself? You mentioned, you know, that program helping to ease the burden a little bit for your sector, but is your sector going to be able to handle this kind of demand now and into the future?
Yeah, we need a Helping Healers Heal for the healing healers. You know, we're trained, thankfully, in our jobs, we are trained to actually do this. This is something that we are used to doing. That's not to say that we are without our flaws in this area. You know, we are all, I can speak for my colleagues and for myself that I've talked with, we're all experiencing a lot of burnout right now. It's been a heavy few months. You know, we had a little break there for a little while. There was this little period where things kind of went down, but over the past few months, especially with the holidays going on, it feels at times like you're taking crazy pills because you're doing your best not to travel, you're doing your best to stay away from others and socially distance, and then you see all these reports of the cases rising because people are going to these holiday parties and everything like that. So it just feels at times like you just don't know what to do. But you know, we're trained to do this, and we do the best that we can, and you know, it's a lot of self-care that's involved in the whole thing.
And I'm sure you need some help from other organizations. So what part can hospitals, governments, other entities, the public play to help healthcare workers handle these kinds of issues?
It's a really good question. I wish I had the full answer to that, but what I would say is that the best thing that we can do is to continue to talk about what's going on. The more that we talk about the depression that people are experiencing, the anxiety that people are experiencing, the frustration and anger, the more that we talk about our emotions, the better off we'll be. We start to reduce the stigma around that expression. We start to reduce the stigma around talking about mental health. And it's through doing that that we can really help everybody. I think that's kind of the best step that I would say that we can all take.
Andrew Schwehm, thank you so much for your time. We appreciate everything that you're doing there.
Appreciate you. Thank you.
Thank you.